What if the high-fat, low-carb diet that's taking the world by storm could actually help reset your body's relationship with sugar? Let us find out. Diabetes and Ketosis, a comprehensive guide. Diabetes and ketosis are two interconnected metabolic phenomena that play significant roles in how the body manages energy. While ketosis is a natural process the body undergoes to utilize fat for fuel, diabetes involves impaired glucose metabolism. Understanding these concepts is essential for managing health effectively, especially for those with diabetes. This guide will break down the intricacies of diabetes, ketosis, and their relationship into easy-to-understand chapters. Chapter 1. What is diabetes? Diabetes is a chronic metabolic disorder characterized by high blood sugar levels or hyperglycemia due to impaired insulin production, insulin action, or both. Insulin is a hormone produced by the pancreas that allows glucose to enter the body's cells for energy. Types of diabetes. Type 1 diabetes, an autoimmune condition where the immune system attacks insulin-producing beta cells in the pancreas. Requires lifelong insulin therapy. Type 2 diabetes, the most common form of diabetes associated with insulin resistance and decreased insulin production. Often linked to lifestyle factors such as poor diet, obesity, and lack of exercise. Gestational diabetes, a temporary form of diabetes occurring during pregnancy. Increases the risk of type 2 diabetes later in life. Common symptoms of diabetes: frequent urination, excessive thirst and hunger, unexplained weight loss, fatigue and irritability, slow healing wounds and frequent infections. Chapter 2. What is ketosis? Ketosis is a metabolic state in which the body uses fat as its primary energy source instead of glucose. This happens when carbohydrate intake is significantly reduced, leading to low glucose availability. How ketosis works. In the absence of sufficient glucose, the liver breaks down stored fat into molecules called ketones. Ketones, including beta-hydroxybutyrate and acetoacetate, serve as alternative energy sources for the brain, muscles, and other organs. This process is commonly activated during fasting, prolonged exercise, or a ketogenic diet. Benefits of ketosis: enhanced fat burning for energy, improved mental clarity and focus, stabilized blood sugar levels, beneficial for some people with type 2 diabetes. Chapter 3. Ketosis versus Diabetic Ketoacidosis, or DKA. While ketosis is a safe and natural metabolic state, diabetic ketoacidosis, or DKA, is a dangerous complication of diabetes, particularly type 1 diabetes. So what is DKA? DKA occurs when the body produces excessively high levels of ketones due to insufficient insulin. The blood becomes acidic, leading to life-threatening complications. Symptoms of DKA include rapid breathing and shortness of breath, fruity-smelling breath caused by acetone, a type of ketone, severe nausea, vomiting, and abdominal pain, as well as extreme fatigue and confusion. Causes of DKA can be missed insulin doses, infection or illness, and uncontrolled high blood sugar levels. Treatment of DKA requires immediate medical attention, including insulin therapy, fluids, and electrolyte replacement to restore metabolic balance. Chapter 4. The relationship between diabetes and ketosis. Ketosis and diabetes intersect in complex ways. For people with diabetes, achieving controlled ketosis can offer metabolic benefits, but it must be carefully monitored to avoid the risk of DKA. Ketosis in type 1 diabetes is not typically recommended unless under strict medical supervision due to the high risk of DKA. On the other hand, ketosis in type 2 diabetes can be beneficial. A ketogenic diet can help improve insulin sensitivity, stabilize blood sugar levels, and promote weight loss. Chapter 5. Practical tips for managing diabetes and ketosis. Monitor blood sugar levels. Regular testing ensures glucose stays within the target range. Check for ketones. Use urine or blood ketone testing kits to monitor ketone levels, especially during illness or high blood sugar episodes. Stay hydrated. Dehydration can exacerbate both high blood sugar and ketone production. Follow a balanced diet. For ketosis, stick to low-carb, high-fat foods like avocados, nuts, and fatty fish. For diabetes, incorporate whole grains, lean proteins, and plenty of vegetables. Exercise regularly. Physical activity improves insulin sensitivity and helps regulate blood sugar levels. Consult a healthcare professional. Always discuss dietary or lifestyle changes with your doctor, especially if you have diabetes. Chapter 6. Early warning signs and prevention of complications. Early warning signs of DKA, persistently high blood sugar levels, over 250 milligrams per deciliter. Moderate to high ketone levels in urine or blood. Preventing complications. Take prescribed insulin or medications consistently. Address illnesses promptly to prevent stress-induced ketone production. Maintain a balanced diet and avoid extreme dietary changes without professional guidance. Chapter 7. Conclusion. Diabetes and ketosis are distinct yet interconnected processes that require careful understanding and management. While ketosis can be a powerful tool for improving metabolic health, it must be approached cautiously, particularly for those with diabetes, to avoid the potentially life-threatening complication of diabetic ketoacidosis. By staying informed, monitoring your health, and working closely with healthcare professionals, you can safely navigate the complexities of diabetes and ketosis and achieve optimal well-being. Knowledge is power when it comes to managing diabetes and metabolic health. If you found this guide helpful, please like, share, and subscribe for more health and wellness insights. Let's empower each other to live healthier, happier lives.